Planning for Change, a Leader's Vision. The purpose of this presentation is to demonstrate how we can bridge the gap for the safe administration for medication to mitigate harm to the patient and enhance nurses' care delivery. According to the American Society for Health System Pharmacists, medication therapy can improve quality of life and improve therapeutic outcome. So the goal of medication therapy is to achieve a defined therapeutic outcome that will not only improve the quality of life for the patient, but also for the desired population. Planning for change, a leader's vision. This is associated risk with medication therapy, caregivers' participation, and the organization vision for quality delivery of healthcare. There are inherent risks associated with the use of medications, and caregivers' participation can help to prevent or mitigate the risk that may cause harm to the patient when administered appropriately. The organization quality mission is committed to transparency in communication with its patient by recognizing their rights to be informed about all aspects of their care, treatment, as well as services. A recent review of current medication administration scanned report and the frequency of medications that the nurses in the perioperative unit missed scanning before administration. The report reveals that over 20 to 25% of all medication administered weekly were not scanned and were manually documented. To prevent tragic and serious morbidity and mortality rates, risk reduction strategies and systems must be established to alleviate patient harm from medication errors. Nurses and caregivers performing medication therapies should take the time to verify and assess the patient medication history, the allergies, to avoid potential risk for harmful drug interactions and allergies at the point of care. In a recent study analyzing more than 150 drug allergies, Slight et al. Report that within a single healthcare system, the study revealed that 81% of patients with drug allergies were overridden by clinicians, and the appropriateness of prescribers' reason for doing so was captured. This alarming figure contributes to the medication error and warrants improvement in the accuracy of allergy documentation in the electronic medical records. The current system is flawed as evidenced from the data collected from the daily scan census report which pharmacy issue on a weekly basis. Therefore, an improved and evidence-based practice system consists of executive leaders, nurses, pharmacy, and information technology is needed to augment the system currently in use. Focus on performance measurement is an initiative of the Affordable Care Act. According to Fessel, Yandro, and Mallory of 2014, recent emphasis on improving quality healthcare to meet the Affordable Care Act is requiring strong focus on performance measurement, which sparks many reasons to participate in nationally benchmark quality measurement programs to achieve or maintain accreditation, maintain or improve reimbursement, or demonstrate excellence in quality in service delivery. Proposed change to reduce the risk of medication errors involve executive decisions of interprofessional collaboration to evaluate and monitor the administration process throughout the system, and a strategic approach that strives to build protective mechanisms that will safeguard and mitigate errors from future occurrence. What are some of the outcomes for initiating the safety gaps? Role of nursing in improving a culture of safety, according to Ulrich and Keir of 2014. For the organization to accomplish this safety and quality initiative, hard stops must be incorporated and implemented in the medication administration and documentation process to ensure a safe and quality delivery is achieved by all caregivers. The recommendation is for a six-step approach to enhance the delivery of care should include all patient identification number must be verified electronically before the clinician can dispense the medication. Scanning must be initiated before signing on the MAR is completed. No manual documentation can be entered for medication administration reconciliation. All medication should be reviewed by pharmacy before dispensing. A purposefully adhering to the 5 rights of medication administration. Studies have shown the scanning of barcode technology helped to reduce medication administration errors as reported by the American Society of Healthcare System Pharmacists. Last but not least, nurses' education and training development is essential in providing a safe, quality care that the organization is aligned to do. Nurses are emerging as safety leaders. According to Ulrich and Keir 2014, nurses remain central to providing an environment and culture of safety, and as a result, nurses are emerging as safety leaders in the healthcare setting. With the expertise and knowledge of interprofessional collaboration between nurses, pharmacy, and other disciplines that have direct interaction with administration of medication, an enriched and secure structure for delivering drug therapy is warranted to safeguard the quality of care delivery and the safety of our patients. Accomplishing the desired strategic goals, the organization will be aligned with the Institute of Medicine, the IOM initiative to Err is Human, building a safer health system and crossing the quality chasm. Start again. A positive, non-punitive environment for reporting errors can provide valuable opportunity to enhance safety, according to Clift, Brower, Frank, and DeHoig of 2014. The expected outcome arising from the proposed change will foster a culture that supports a non-punitive behavior to promote reporting of safety risk. A positive, non-punitive environment for reporting errors can provide valuable opportunity to enhance safety. Implementing the enhanced system will help leaders and stakeholders to evaluate errors arising from flawed systems or inadvertent human errors or behavioral choices that compromises the quality and safety of the patients. It also will help to improve the strategic value of the organization by creating a safe and secure method for administering medication therapy to the patient, as well as the pharmacy playing an important role in tracking and reporting and also enforcing scanning of all meds. Staff engagement is also crucial and utilizing communication tools to effect desired change. According to Goal and Cahill, incorporating the strategy deployment wall approach is a very thought out process that can be effective in communicating organization strategic goals. It also helpful by outlining the elements required to achieve the metrics for the goals and engaging staff participation in developing a unit-based project that will enhance patient safety and quality outcome, as well as inspiring the frontline staff to contribute valuable resources to help in sustaining the desired outcomes. The creative ideas of the nurse leader and staff will have significant impact and what will influence all aspects of the patient care that affects safety and quality outcome. My final thought regarding this valuable issue for safety and quality healthcare delivery, we must remember that to foster the reporting and reviewing of medication errors, it is essential to incorporate interprofessional collaboration. Pharmacy role will be instrumental in taking control as well as accountability for monitoring the medication administration process. Engaging in collaborative effort to prevent medication-related dilemmas that can cause harm to the patient will help to make a positive difference in benchmarking the organization quality and safety initiatives for barcode scanning of all medications before administration. Once again, thank you all for giving me this opportunity to present this quality safety initiative, and looking forward to get your support in getting this initiative up and running to enhance our patient safety and also to enhance our nursing and care delivery practice for the organization. Thank you.